Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com in week 38, the 9th month of your pregnancy. I'm Monica Healy. Your baby is the size of a pumpkin. Let's talk about what is happening with baby this week. Packing on the fat. Your pumpkin is a mass of 6 pounds, 13 ounces, 3 kilograms, and measuring in around 19.5 inches or 50 centimeters in length. Baby's tiny round head is approximately the same circumference as his abdomen. Can you imagine if your head and abdomen were the same size? Baby is losing the vernix caseosa, a white cheese-like covering, but growing some locks. He may have up to an inch of hair at this point. The rest of his time in the womb will be spent accumulating all of the fat that will make him or her such a cuddly, adorable baby. For several weeks, your baby's development has been more about improving the function of organs than construction. Her organs are prepared for her first breath of oxygen. Her brain and nervous system are working more efficiently every day. But this developmental process continues throughout childhood and even into the teen years, hence the reason drug and alcohol exposure may endanger baby's development. In these last few weeks, days, or even hours, baby's brain continues to prepare to manage the complicated tasks of breathing, eating, digesting, and maintaining a healthy heart rate. Those are not the only jobs baby's preparing for. Readying himself for birth, your baby engages in activities he will use once he's born. Baby probably spends a lot of his awake time perfecting sucking. Baby's awake quite a bit more these days. He's also absorbing all of the sensations around him and responding with expressions, movements, and other reactions. Although baby should continue to move as much as usual, he won't be making any large movements. He's grown too large for his environment. Okay, now let's see what is happening with you this week. The waiting game. As those pesky symptoms persist, itchy belly, vaginal discharge, Braxton Hicks contractions, swollen feet and ankles, and trouble sleeping, you may become increasingly anxious for delivery day. Don't rush. Baby will emerge when he's good and ready. You may also be feeling even more pressure on your pelvic floor and less pressure in your chest and stomach as baby continues to descend into your pelvis. This may also cause what some have coined lightning crotch, because it feels like, lightning shooting up and down your legs and into your pelvic area. That low baby is resting on sensitive nerves. At this point, some women experience depression, feeling more irritable than usual and finding everything such an effort. It's the result of anxiety about the forthcoming birth, fatigue due to lack of sleep, and a desire for the pregnancy to come to its end. Speak with your healthcare provider should you feel any high levels of anxiety. Also contact your practitioner if you experience any of the following: excessive or sudden swelling in the hands, face, ankles, or feet, a severe or persistent headache, vision changes such as blurriness, seeing spots or double vision, or extreme nausea or vomiting, as these could be signs of preeclampsia. What's your labor sign? The signs of labor will soon display themselves as you are creeping up on the 40th week. Be on the lookout for longer and stronger contractions. They may not be Braxton Hicks anymore if you are experiencing 5 or more consistent contractions within an hour. Many women have a discharge tinged with blood known as the bloody show. This will appear as the cervix continues to open and you shed the mucus plug which has acted up to this point as a fence keeping baby safe inside the womb. Once you've lost your mucus plug, labor is just around the corner. Another symptom of labor is diarrhea, as your body empties itself out to make extra room to push baby through the birth canal. Keep in mind that many women do not go into labor until their due date or beyond. Take this time to relax, take naps, read a book, spend time with your partner, because there will be very little relaxation when your bundle of joy arrives. Here are some of my tips for week 38. Find time to relax. It is just as important as everything else going on around you at the moment. Complete all finishing touches on the nursery. There is no guarantee when baby will decide it's time to meet you. Stock the fridge with anything you may need for yourself and baby. It's always a good idea to have some frozen meals prepared for after baby's arrival, because you'll not have the time to cook with a newborn keeping you on your toes. If you have any questions or comments, please join in the conversation in the forums at pregnancychat.com. I can't wait to tell you what is happening during week 39. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.